Hello again, this is Dr. E, aka the Detox Doc, with the next series or next category in the series that we're doing on fatigue and low energy. And today we're going to talk about the thyroid. The thyroid is one of the most widely misdiagnosed and underdiagnosed problems that we have here in the U.S. There are about 50% of people who have a thyroid problem that are told by their doctors that they're okay or that they're functioning normally. So I just wanted to quickly go over just a general overview. This is not an in-depth thyroid conversation or breakdown, but I just want to go through some of the classic signs and symptoms of a thyroid problem so that if you feel like you are experiencing any of them, then you just have some more information to speak to your practitioner and your doctor about this and possibly investigate a little bit further so that you can get yourself handled easier. So hypothyroidism is just basically when your thyroid is not producing the hormones that are needed to provide energy throughout your body. Your thyroid works like your body's gas pedal, meaning that if you are sitting still listening to this video right now, your body is automatically using its metabolism inside of your cells to produce a certain amount of energy. Energy levels have to change according to the demand that is placed on your body to produce more energy. So if you were to stand up and start doing a bunch of jumping jacks and working out, your thyroid is going to help control and manage the energy output that your body needs according to what you're doing. So I mentioned that it is similar to a gas pedal in a car, how it can control the speed that the car goes. Your thyroid controls basically the speed of metabolism in your body with some other organs. But like I said, we're going to keep it very general today. So the issues with the thyroid problem are that when it stops functioning the way that it should, there is a global breakdown of your entire system where your metabolism changes all over because your thyroid helps to control all of the cells in your body. It's not specific to one area. So if you have a bad thyroid, it's not going to just affect your sleeping. It's not just going to affect your arms or your legs or different organs. The hormones that are released are called T3 and T4. They are basically effective at controlling iodine levels and things along those lines. So here's a picture: T3, T4 hormones that are produced by the thyroid, and when you lack sufficient amounts of T3 and T4 hormone, they will diagnose it as being hypothyroid or called hypothyroidism. So some of the main symptoms of a thyroid problem, as you can see here, number one is going to be fatigue. Weakness can come along with that. Weight gain is a very big sign of hypothyroidism. The weight gain, however, again, is going to be a global weight gain. So if you or you know someone who has gained weight and it comes all over the body, and you exercise, you eat right, you do all the right things that you're supposed to do, but you just can't seem to lose any of the weight, you may want to investigate your thyroid if you haven't. Now, the skin also changes. Your hair texture can become dry. Your skin texture can become dry. You can lose hair. One of the other classic signs of a thyroid problem is that you have an issue with body temperature and you feel to be cold on the inside, even though the temperature in the room or outside is normal. You have the chills, or you always need to wear a sweater or just put a blanket over you. That's one of the major signs and symptoms. Muscle cramps can occur. Constipation occurs because, like I mentioned earlier, when your metabolism slows down, the hormones slow down, so the output of everything slows down. Your digestive system becomes lax as well. So constipation is a very common sign. Depression, when someone is diagnosed with hypothyroidism and they come into the office with feelings of depression or if they're taking an antidepressant medication, I always ask, was there a reason for you to be depressed? Because a lot of times with hypothyroidism, there is no traumatic event that causes the depression. It seems like you're depressed for no reason, or you just feel very, melancholy or in the blues and just down in the dumps, but you can't put your finger on why. So that is a classic sign of hypothyroidism. Then some other things along with the depression and the mental focus of some issues are memory loss. You can't seem to remember and recall things that you used to have no problem with. So maybe it's an issue with pulling up old phone numbers or names, or you put your keys down and you can't remember where you did that, or you walk back into a parking lot and you can't see your car and you don't know where you parked, things like that. Abnormal menstrual cycles in women, decreased libido. Libido just means sex drive, so you just aren't in the mood sexually. So those are some symptoms. Those are basically the classic symptoms of a thyroid problem. Usually they will all seem to appear together. So if you have one of these issues, it may not be so much a thyroid issue. It may be something else. But if you have a few of these out of the list, then you may, like I said, want to investigate it. The issue with thyroid problems and diagnosing them is actually there's a lot of controversy on how the test is done. Thyroid is tested by a blood test, and the blood test can measure whether your body is producing enough T3 or T4 hormone, and it shows whether that is in the bloodstream, but it doesn't measure if those hormones are getting into the cell and doing what they are supposed to do, and actually performing the functions that hormones need to perform at cells and make sure that everything works well. The other issue can be that the thyroid is not the main problem. Your thyroid gland information from another gland in the body called the pituitary. Your pituitary is what sends the thyroid its information, and many of your other glands. We spoke about it a bit in the first video when I was mentioning the adrenal glands. So that's where the thyroid comes from. But if your pituitary has a problem, then the thyroid is going to have a secondary problem because it's getting faulty information. And if your pituitary is getting faulty information from the hypothalamus, then you have some more issues. But like I said, I'm going to try and keep this one very general. So when you are dealing with hypothyroidism, and if you are being treated medically, they will give the most common drug for that. It's called Synthroid. It's a very small, tiny blue pill, and you have to take one a day. And what it will do, it will keep your thyroid levels at a normal amount so that you don't have any major heart conditions or have any very serious problems, and it does keep you in balance. However, a lot of times you will hear that you have to take this drug forever. Which I will speak on in another video, but I have found that to not always be the case if the patient is handled correctly. So this is just some information. If you feel like you have any of those symptoms from the thyroid list of hypothyroidism, check with your doctor. Of course, you can email me. I'll try and help you out in any way I can to send you in the right direction. But just wanted to share that information and look out for the next video.